Smiles and relief at Epsom Racecourse, one of the 7 mass vaccination centres to begin welcoming patients. But is the promise of a vaccine at hand making people too complacent? The UK is under its 3rd lockdown, but the government says the next few weeks could see the worst of the pandemic if people do not follow the rules.
This is a very perilous moment because everybody can sense that the vaccine is coming in. They can see that the UK is vaccinating large numbers of those who need it most. And my worry is this is the moment where that could breed a false confidence, false complacency.
The UK government has not ruled out more restrictions in all areas, including exercise. The rules say that people can leave their homes to exercise once a day, meeting one other person. There is concern that these rules and others are simply not being followed.
Now is the moment for maximum vigilance, maximum observance of the rules, and of course, if we feel that things are not being properly observed, then we may have to do more. But far better for people to obey the rules that we have than simply to promulgate new rules.
But some say the government's 3rd lockdown has been problematic.
There's pubs, there's restaurants, all doing takeaway services. There was none of that. And now they've got savvy to it because people want it. So there's more people congregating along the river, having a drink. And, we're like them. We'd like to go and have a drink on the river because they can. Whereas in the first lockdown, there was nothing open.
People my age, and they're fed up. So they're bending the rules, breaking the rules. And I don't think anything the government say people really trust now.
The government found itself talking about rules on a day when it wanted to herald its vaccination strategy, with the Prime Minister saying 2.4 million people, roughly 40% of the over 80s, had already received their jabs. The target is 15 million, comprising the over 70s, those shielding and health workers, by the middle of February. But over 32,000 patients are being treated in hospitals for COVID, a 20% increase on the previous week. The fear the National Health Service could be overwhelmed is very real.
I think anybody who is not shocked by the number of people in hospital who are seriously ill at the moment and who are dying over the course of this pandemic, I think has not understood this at all. This is an appalling situation.
Catherine Drew, CGTN, London.